everybody. This is Dr. Brett Talley Daniel, MD, a neurologist and headache doctor. And today I'll be podcasting on the subject of medication-induced migraine. Migraine is a genetic, familial-related neurologic problem involving the thalamus, the cerebral arteries, and the trigeminal nerve. In the migraine process, inflammatory neurochemicals, CGRP, neurokinin A, and substance P are released and inflame brain structures. Migraine has many triggers, and certain medications can act as migraine triggers and make it worse. Medication-induced migraine. Medications that induce migraine include SSRIs, antihypertensive drugs, and estrogens. The chemicals in these drugs cause the release of neuroinflammatory chemicals and the start of the migraine process. This note is not about medications that are overtreated and which cause medication-induced headache. Medication-induced headache is a process of overtreatment that builds up with time, usually in persons with migraine, to cause frequent or daily headache. Overtreating with medications is an important but separate medical issue than what I'm speaking of today. The drugs listed here cause a migraine headache to occur soon after taking a single dose of the drug, acting in this regard like a trigger. Many are aware that environmental triggers like stress and caffeine often aggravate migraine, but few know that medications for unrelated and relatively benign conditions can also set off migraine attacks. So I'm going to list classes of drugs that worsen migraine. Antihypertensive drugs such as reserpine, hydralazine, nifedipine, birth control pills, oral birth control pills like orthonovum or LS, estrogen patches, an intramuscular injection of estrase or estradiol, coronary vasodilators for angina like nitroglycerin and nitrates, histamine receptor agonists like cimetidine, decongestants, mainly Sudafed, which is in Advil, Sinus, and Dristan, and tons of other drugs. Nasal steroids such as Flonase, and a list of others. SSRIs, those are selective serotonin receptor inhibitors for treatment of depression, anxiety, panic disorder, like Prozac, Paxil, Zoloft, Celexa, Lexapro. Bronchodilators such as theophylline, proton pump inhibitors, PPIs, like Prilosec. Of course, opiate narcotics like Vicodin, hydrocodone, tramadol. Tracking medication usage. Watch out for caffeine as coffee, tea, chocolate, etc., and BC powder. A medication tip. Unfortunately, the most common of all medication side effects that any medication, drug, or supplement may cause is headache. Sometimes just tracking all of your medication uses and stepwise eliminating one of the drugs will reveal the source of medication-induced migraine. So this is the end of this talk. Thank you for listening. Please click subscribe down there. God bless all you persons who have migraine. And I shall see you on the next talk.